Up to about 45% of our call volume is medical calls, where we provide support to Alberta Health Services, emergency medical services. Certainly we don't have training to the same level or equipment to the same level as them, but very often we can get to a person in medical distress much quicker than them and administer some pretty critical medical interventions. We can defibrillate, we can provide oxygen, we can do CPR, we can stabilize C-spine. We can deal with people who are suffering from choking, those kinds of things that are very immediately threatening. We can deal with significant bleeding and significant trauma as well. Again, that increase in the overdoses tells you the story, right? So we're 2.5 times as many as we were, in 2016. If you crunch those numbers roughly, 3 times a day we're going to an overdose call, and 1 out of those 3 we're administering Narcan, naloxone, to patients. So we run a very light and lean service, and I've said that a number of times when I've talked to council or the administration and as well as the public. We do incredibly well with the dollars we have. I think what will be more challenging as we move into this year, and a very obvious environment where there's significant pressure on the city to allow development in new areas, when perhaps the city doesn't have the ability to support the infrastructure in those areas, and the most expensive early infrastructure in those growth areas is fire service. So I think this year is going to be a bit of a tipping point, and we're going to have a discussion at council here in March around that. I think we're one of the more effective fire services in the country. I think we know that 100% of citizens think that fire service is important. 99% are either satisfied or very satisfied with us, but also 98% believe that we should be present in communities as they grow. The fire service is an essential part of that community, and also that investment in the fire service should remain at a similar level as it is today, and perhaps even more, provided we can show greater value based on that.